Over the last 2 to 3 days, we've seen some very busy days at University Hospital Plymouth Emergency Department, and yesterday in particular we saw over 340 attendances in the ED, which is probably one of the busiest days we've ever seen. Allied to which, we also saw 140 ambulance attendances, which generally we'd see 100 ambulances or so pitching up on the day. So an exceedingly difficult day, which has put tremendous pressure on the emergency department consultants and the department and the hospital in general. I think there are a number of reasons why it's busy. Firstly, I think there is an increasing awareness that there is a gradual increase in the prevalence of COVID within the society, but in particular I think children going back to school. The number of children that have been sent home as a result of some of their friends in class having viral symptoms has put a tremendous pressure. Their parents have then brought them into the emergency department, and we've also seen parents and staff within the hospital also calling in sick on account of their children. So the children going back to school has certainly had a major issue in relation to the surge. The emergency department is set up to see patients that require urgent and critical care. It is not seen as a mechanism, and it's not set up to deal with minor ailments. Minor ailments should be seen through primary care or through 111. As a result of the massive surge, it means that the patients that are seriously ill potentially could get delayed. We do have a prioritisation system that usually picks these patients out, but what it will do, it crowds the department. We do try to space patients out within the department in accord with social distancing, but as a result of that, the department operates slightly slower than normal, and there will be quite substantial delays for people coming up to the department. And if you don't need to be seen here, it's far more effective for people to use their time attending their general practice or phone in 111. I think it's been seen across Devon and Cornwall. I'm aware that colleagues in South Devon have also experienced quite a similar surge. And on a regular basis we check in with the South West Ambulance Brigade and other trusts in the evening just to assess their situation. They're reporting equal pressures. If you're feeling unwell and you're not critically unwell, I think you should firstly try to book an appointment with your general practitioner. If you can't be seen face to face, book an online attendance. And failing that, you should try and ring 111. 111 will give you really good advice, particularly if you've got a minor ailment. I would emphasise at the end, if you've got an urgent or critical problem and you need emergency treatment, ring 999. That remains the default position, but many of the people that have been attending the department could have been adequately managed through their general practitioner 111 advice.